Now, the World Health Organization says that Ebola vaccines are on their way to Guinea to deal with a new outbreak of the disease. 5 people have died and 2 have tested positive, while 10 others, they have symptoms. The outbreak is linked to a funeral in early February, and authorities are trying to track down anybody who had contact with those infected. Nick Hack joins us live now from Dakar in Senegal, and that's the thing, isn't it, Nick? It's just trying to get in touch with those people who may have been infected.
Yeah, it's a race against time for the health workers to get on the ground, but also to get the vaccines on the ground. Remember, in 2014, 350,000 vaccines were distributed in Guinea, Liberia, and Sierra Leone, where the outbreak took place. Now, Dr. Sakuba from the Ministry of Health in Guinea says that the vaccines that they have, the doses that they have, are now expired since December 2020. So some of the vaccines will be coming from Geneva and other countries, and it's really about trying to get it on the ground deep in Nzerikore in southern eastern Guinea. So that's the challenge ahead. And some of the organizations involved in this are organizations that are already on the ground in DRC, where there is another Ebola outbreak. Joining me now is Nicolas Mouly from ALIMA. You're the head of the emergencies, and you'll be distributing vaccines in Guinea. What are the challenges ahead, and how quickly can we get the vaccines on the ground?
So we work with the Ministry of Health and the WHO and other partners to distribute the vaccine on the ground. I think what is very important now is to make them available in Conakry, but also in Nzerikore, and to give the good message for the population to be sure that they will accept to get vaccinated as a strong measures to contain the outbreak.
So you think it's going to be challenging to get people to take a vaccine against Ebola, despite so many people who have died in the past? Why is that?
No, I think it's really easy if we give the good message, and if we just say, okay, listen, the vaccine is efficient during 12 to 18 months, and it will prevent you to get Ebola, then of course everybody will want to be vaccinated. The challenge now would be to be sure that there are enough doses in the country for this population.
Do we know how quickly we can get those vaccines on the ground in Nzerikore?
Well, it's a 2 days drive between Conakry to Nzerikore, so as soon as they are available, they can be deployed. And again, the Ghanaian authorities are working on that strongly.
This outbreak that killed 11,000 people, infected more than 20,000 people in West Africa a couple of years ago, and yet there are no vaccines in these countries. Why is that?
So a lot of vaccines have been used in the previous outbreak in DRC, and at this time the vaccines were used under a study protocol, so they couldn't be produced in big quantity. But now that the vaccine has been authorized by WHO, the US, and Europe, the manufacturer can produce a larger quantity and then deliver it to the country when it's needed.
Now, if I understand well, this vaccine needs to be kept at very low temperatures, under minus 80 degrees Celsius. And you're going to try to transport these doses to a country where it's extremely hot, where health facilities sometimes don't have access to electricity, let alone running water. What are the challenges to try to get those vaccines on the ground?
Yeah, these are mainly logistic challenges, so we have to be sure that we have all the necessary cold chain and the electricity to make them work. All these have been used in DRC, for example, so we can definitely do the same thing in Guinea.
Nicolas Mouly from ALIMA, thank you very much. Now, really, the challenge ahead is not just the vaccine, it's also trying to communicate with the communities on the ground during a global pandemic. So certain countries surrounding Guinea have taken steps. Liberia, Sierra Leone are in a high alert to try to see if there are contact cases within their borders. And right now, the health authorities in Guinea are trying to get onto the ground, trying to find out who this nurse who was the patient that died from Ebola, who she was in contact with, to try to find patient zero, to try to contain this outbreak. Nick?
Indeed, a race against time, Nick, as you say. Nicolas Hack there reporting.